The purpose of this session is to share the European perspective in training in interventional cardiology and the system we have in Bulgaria at the moment, just to show what is the situation in Europe. Probably it is quite diverse in different parts of the European Union. What is our system, which is have some changes, I think, during the last years. I think that it will be very useful for both sides, just to share how and what we are doing in this field, which practically ensures our future, because we have to prepare the next generation of interventional cardiologists. And my co-moderator is Professor Velchev, and for this session we will be on panel with Professor Van Bel from Lille, Professor Kiefo from Milan, Professor Trendafilova, he was here, I saw her just 2 minutes ago, okay, Professor Gelev, Professor Petrov, and Professor Karamfilov. And I propose just to start with the presentation of Eric, just to share the European perspective in training in interventional cardiology.
So good morning, everyone. Again, thanks a lot for inviting us. As a representative of EAPCI I, we got to discuss this issue, very important issue of education and training in interventional cardiology. Indeed, European and also EAPCI I perspective. So again, just to let you know that indeed, that it was discussed, there are currently different kind of training in Europe. Most of the training in interventional cardiology are based on 2 years of training with some practical aspect and some theoretical aspect, but not all countries are very much organized. And I would be very interested to hear, I heard a little bit about it, about how you are organized here in Bulgaria, but it will be interesting to see your own organization and to discuss after that. So, we have decided sometime, a few years ago at the level of EAPCI I to propose a kind of unified EAPCI I certification with the purpose, several purposes, which is indeed to define a kind of standard to protect patients and to allow to harmonize, because again, there are differences among European countries to try to harmonize as best as we could the training, and also to allow and to facilitate the exchange of professionals from country to country. Let's say somebody is trained elsewhere and want to work in another different country. We need to be able to provide this kind of, let's say, standard. This is not easy to perform because basically we need two parts for such a certification. We need a practical part and a theoretical part, and it's not, again, so easy to organize. So again, this has been created, and okay, we have to first to define the knowledge, skill, and attitude need to be done for this, and we have written and published in your intervention in 2020 a core curriculum defining what is part of this training. And we have training, we have exam session once a year, and the next one session is in December 15. So it's coming quite, it will be by the end of this year. We have one session a year for this online exam. And I will explain how it works and how somebody can apply to it. Currently, it's based, and it will something that we will have to discuss. Currently, it is based on individual registration. So people have to apply by himself, and the cost is provided there. But we will discuss later. The idea would be again to develop some collaboration with different countries, and I will explain where we are in this context. And then at the end, you get, again, a certification. So where are we currently? So we have already certified 250 interventionalists. The top 3 countries are Portugal, Germany, and United Kingdom. But you can see that we have certified people in very different and very large number of EAPCI related countries. So this theoretical exam is, again, very well structured. Some of you may know the general cardiology exam. Okay, general cardiology exam, and basically we are using the same template. So again, we have 2 parts, theory and practice. So the theory exam is based on the guidelines, the textbooks, the fellows course, the seminar, and also on the content of the core curriculum that is, again, published in Euro-Intervention. It has been published. Again, this theoretical part is mainly, again, to recognize the knowledge of a general interventional cardiologist. So the main track of questions are about coronary, and the number of non-coronary questions is limited to 15 out of 100. So 15% of the questions are outside the coronary field. So again, it is mainly to certify for the general interventional cardiology people. So again, this exam initially used to be a physical exam that we have to be part of either the PCR or the SC and be physically present to pass the exam. Now it's organized on a web-based principle, which makes the things more simple. Again, the next session will be on December 15 this year. So it's based on MCQs, so relatively simple, not simple, but the process is quite simple. Just here to give you an example of one of these MCQ that are part of this exam. Of course, in addition to that, the theoretical knowledge is not the only part. We need also a practical part, and it is currently one of the difficulty regarding the certification. So the way we process now is mainly using logbook, individual mentorship, and then you have to provide, just an example of this logbook, you have to provide, and this needs to be certified by your mentor when you apply to the practical aspect of your practice, and also the number of procedures that you have done. Once you have completed both the theoretical exam and this logbook, then you can be certified. So again, the interest also is potentially to define, again, a collaboration with some additional, this is shit, I'm sorry. I missed some of my slide. Okay, so where we are now, could you put my slide maybe not in the presentation format?
Може ли да отворите презентацията в
So because I think my slide have been hidden.
В обикновен PPT, да не е в presentation. Има ли възможност да отворите презентацията? Да.
But not in the presentation mode. Just. No.
Само да не е в като презентация за извън, както е на монитора на компютъра.
Okay, that's so. Okay, this slide Okay. Can I have? Okay. So, Jens, thanks a lot. This is basically what I want to come. So, right now, you have several countries where there is some degree of certification, but this certification is only done based on the practice. They don't have a theoretical exam, and it is the case for two countries we are currently discussing with, which is Switzerland and Spain. So they are well structured. You can get a kind of certification, but currently the certification is only based on the practical aspect. And they have identified that indeed this is not sufficient. We need to have a theoretical part. Again, we have discussed this already yesterday. The idea is because we don't want only to train technicians, we want to train full physicians who have the knowledge of the disease, who are able to manage the patient, and indeed, as part of it, do the intervention. So there is a need of theoretical exam. Currently, they don't have this theoretical exam in Spain and Switzerland. Next slide, please. Yes. So the plan is, what we are currently discussing with these two countries is, again, using the similar scheme of the general cardiology exam, is to have the trainees from Switzerland and from Spain to be registered by their own countries, and then the theoretical exam will be used for local certification by Spain and Switzerland, meaning at the end of the exam, the theoretical exam will be run by EAPCI I, the practical exam will be run by Spain for Spain and by Switzerland for Switzerland, and at the end, the trainee will have a double certification. He will be certified by Spanish Society and he will be certified by EAPCI I. And also what will be potentially interesting is that the fees will be much less, and it will be covered with, by the local society. Next slide. I cannot do. It does not work. Okay, sorry. It works now. What we don't have yet, and we are working on, is the structural heart disease certification. So it's not in place yet. We have written the core curriculum for structural heart disease, and the next step will be to, again, to have a similar certification for structural heart disease. What is very important as part of this certification, that it is acknowledged that to be trained in structural heart disease, you need first to be trained in interventional cardiology. So besides this, what is also important are the EAPCI I Fellowship Grants Program, where, again, some people from different countries could be trained elsewhere, because we believe that it is also important to be able to move and to be able to learn different techniques and to see how different countries or different places are working. So here you have what the situation of the number of industry members that we have. It was a lot of effort by the grant committee to increase the number of grants, and again to also to increase the number of hosting centers. So we have currently 40 hosting centers, and we will discuss about this at the end of the presentation. Then again, to present some of the applications. So most of the applications are coming from Italy, Egypt, Germany, and Romania, but you see that you can have a lot of applications from different countries. And again, to show that between 2022 and 2023, there was an important increase of the number of grants, again, to be delivered, and with a specific effort to provide grants for women. What is also important as part of this is the recognition of teaching centers by EAPCI I. So it is, again, something new, kind of accreditation process. And again, to explain that EAPCI I training grant can only be allocated to fellows spending their training in this EAPCI I accredited catheterization laboratory. So there is a general rule about it. This basically need to be done, in connection with the National Cardiac Society. And again, the centers should have, just as mentioned on this slide, use the usual, aspect of training. So we have also requirements regarding physician operators are part of this. And what is mentioned, we will see also on the next slide, it is important to have at least one CTO expert and to have at least one imaging or physiology expert as part of the center. So we have defined two types of centers, coronary-only teaching centers, but again, with a specific emphasizement for intracoronary imaging, physiology, CTO, INOCA, and which is part of this. And we have also requirement for structural teaching centers. So again, you see some examples, the number of TAVI, number of mitral clip, mitral procedure, and transeptal. There is a cost of this, as you can think about, you can see. But again, it is very important because it allows to receive some fellows in these centers. Also, maybe my final slide will be about this. So you will hear about it. Maybe you have heard about it, about the new EAPCI I membership. This new membership will provide you some additional benefits and will be the only way to get voting rights. There is a fee for this, but again, this fee can also be paid by third party, but it is important to know that, again, this has been done to be aligned with the other association and based on the SC request, but it is also important that you are aware of this. But this can be, there is a cost, of course, but there are benefits associated with that. And this, again, can be paid by a third party. So again, this is my final slide. So just to remind you, so the purpose of EAPCI I is to make sure that we can connect and align the different countries. And we have defined a platform that we want to propose to help the different countries to organize and structure their own certification program. For the time being, it's mainly on general interventional cardiology, and the next step will be to develop a structural heart disease certification, again connected to EAPCI I and in connection with the different countries. Thank you very much for your attention.
Thank you, Eric. Please join to us. That was quite informative, and I propose that Professor Velchev to give his talk, and then just we will have enough time to discuss, I think, this very important topic.
The title is Education and Intervention in Cardiology, but education being formal or informal. And we are mostly will be speaking about the process of certification in Bulgaria, which is the formal part. So I will skip advertisement of our national congress and bifurcation course and going straight to the top. Bulgarian perspective. So how does it start? Why do we start to certify interventional operators at all? So the reason for this certification to exist in invasive cardiology in Bulgaria is acute coronary syndrome. So as you all remember, STEMI invasive coverage started in Sofia in 2001, and the program started operating in 2002. And then since 2004, several Stand for Life national initiative started to increase the coverage of the Bulgarian territory for acute coronary syndrome. So as you can see, we started with the very low numbers of the primary PCI, And then we have a very rapid growth, which I think is something which happens also in Europe. So if you compare centers in 2008 and 2012, it's just 4 years, and you already have a huge proliferation of cath lab facilities. Nowadays, it's actually twice the number that we have in 2012, and we are approaching something like 60 cath labs for Bulgaria, which is maybe quite too much. So the big question is why certify interventional cardiologists, and my personal feeling is I'm not very convinced that we have good reasons to do this, but why we do it at all? We do it because the PCI is very readily available. We have a big working force of interventional people. We used to have a national standards for cardiology. We don't have them any longer, but in this national standard it was written that we are obliged to use a certification. And in the beginning we needed a unified certification to ensure a quality and access for the citizens in Bulgaria to a life-saving emergency intervention. As you remember, in the beginning, it was a business for the Ministry of Health. It is for the only one commission. And of course, primary PCI is a basic part of the intervention cardiology training. It is its emphasis in our certification program. So what's the requirements? Maybe you know it too good already, but the candidate should have a specialty of cardiology, spent 2 years in the cath lab after having a specialty. Certain experience in the coronary diagnostic is a must, 100 procedures. Experience in the PCI as a primary operator in a home cath lab, 50 procedures. Limited experience in the university-affiliated cardiology clinic. It depends on the university, but it's required. And very, very limited experience by paper in pericardiocentesis and balloon counter pulsation, because in the beginning we decided that that is something that every operator should be able to do on an emergency basis. The curriculum is very broadly defined, but concentrated on diagnostic, angio, and hemo, and coronary intervention. Actually, there is no other intervention in the curriculum. So who is doing the certification? In theory, nowadays, it's all high medical schools. By law, able to do this. In practice, it's a small number of cardiologists, board of interventional cardiologists, which are affiliated to Medical University of Sofia. But as far as I know, we have already 2 other universities also doing certifications. Exam, you have a practical part. The candidate have to perform a PCI. Then we have a case-based discussion just to evaluate the cognitive and technical abilities of the applicant. We have a test and final interview on the topic which is randomly chosen from the interventional cardiology practice. So that's in theory, but as Yogi Berra said, in theory there is no difference, but in practice there always is a difference between theory and practice. And we have plenty of problems with certification. For example, nowadays acute coronary syndrome is not the only driver of interventional activity. There is a number of other procedures and which are not covered by certification process. And actually, me personally, I don't have a concept whether we should include them in the certification. Maybe we should broaden our educational program and also have some obligatory activities from our curriculum and from the EAPCI PCI. We have several subspecialties already inside interventional cardiology. So we are having people doing mostly peripheral, structural, or coronary intervention, all of them requiring specific expertise, and maybe, of course, EAPCI can help with this sub-certification if needed. We don't know who is financing the education and the examination. For the time being, that is the candidate himself. And the system is operating in this way, but I don't think it's the best way to do it. The situation that we are, in theory, having new boards in every high medical school probably will lead us to having probably 6 commissions certifying in Bulgaria, which is maybe not so good. And my proposal would be to go back to the national certification acknowledged by the Ministry of Health. And of course, quality control after certification for the time being is not possible, I think, because we lack a national registry and we cannot follow the number of the procedures that the certified colleagues are doing after the certification. So that would be my perspective, and I'm open for discussion.
So, a lot of problems, not so big number of solutions. First of all, I will start with our national perspective because, as Professor Velchev said, there was a unified examination till maybe 3 or 4 years ago, and afterwards, at the moment, we have 6, because Professor Velchev actually is involved in this problem with training in interventional cardiology from the very beginning. Actually, he is one of the persons who is on the base of our national training process. So, and he is the man probably the best, who best knows the system. And we have now 6 commissions. I didn't know even that.
No, we don't have 6. We don't have 6 for the time being. I think we have 4.
4. For a 6.5 million population. And we have, by the way, we have in Bulgaria, because we discussed, this is just a very short overview about our national system. We discussed with Eric yesterday evening during the dinner. We have 59 centers with contracts with the National Health Fund for performance of interventional procedures at the moment. And the members of our society is 184 people, physicians. So everyone can calculate the mean number of operator per center if you count on this basis. And but the number of PCIs is enormous. Actually, we are at the moment probably in the first place in Europe per million population, which I think that it's not very something that we have to be too proud, too much.
As I said, it's always a matter of politics. So certification is a partially political process. It's not only education. So I have a question, and this question would be if we are to integrate our education and certification in the EAPCI process. So do we need to have it recognizable by our authorities? Because finally, this certification in Bulgaria have a lot of weight when there is a contract between the insurance fund and the local cath lab. So it will be also a matter of politics.
So again, I think so. The issue of how legal is the certification again can depend from country to country. I think what is very important, you have a current situation with already a lot of people working and doing case. I think the question is, what do we do with the new young interventionalists coming, and what do we want to have from them? For me, there is one first thing that we need to clarify, which is that there is a risk that we will have a lot of subspecialties and we will lose the overall picture. So the question, first of all, as part of the training, and we discussed that yesterday, you could have CTO operators, you could have structural interventionalists, but these people could have the risk to be only technician and not to be real complete cardiologists. And part of the certification should be also used for this. and to clarify first that you need to be trained and certified in general interventional cardiology, and then on top of this go to subspecialty. This is what is part of the EAPCI I certification and what is part of the current core curriculum that we provide and could be used locally. And then the next question is, we should recognize that to organize such certification is a difficult thing to do and to maintain over time. The theoretical exam is not something easy to organize because you have to have session, you have to have question, you have to keep the standard. And probably where EAPCI could help is to organize with you, with the different countries, this theoretical exam that could be used by every country that is interested as its own theoretical exam on which you can provide the practical part. And then at the end, again, as I was mentioning, I think the direction we want to go is a direction where we go with Spain and Switzerland, that basically the local country is organizing the practical part, and we provide a frame of theoretical exam in which we will invite a country representative to make sure that the content can match what your expectation, to make sure that at the end we have a certain level of standard. Regarding the fact that whether it is legally binding or not may depend on the country. It could be the case in your country, it could be different in a different country. But even if it's not legally binding, if you make sure that a lot of people get this exam, at the end it becomes unofficially binding, because at some point, if you don't have the exam, it's more difficult to find a job than if you have it. So it's again a question of balance, whether you want to push in that direction or not for each country.
Eric, I have a question. Maybe this is the most important question regarding the certification, about the mutual recognition of this certification, because probably you can be certified by EAPCI, but if that certificate, at the moment, this is only just the only thing which I can do with my EAPCI diploma is that to say that I'm so proud that I passed the exam. And that's all, because, for example, I'm the only one who passed the exam, and this is okay, but it does not give anything more. And this is probably the most important part. And my question practically is if the Spanish interventional cardiologist certified by EAPCI and local practical exam, is it allowed for him or her to practice in Switzerland, for example?
That's again, the first step is to have agreement between EAPCI and each individual country. But of course, what will happen the plan is over the course of this is that basically the agreement will be about the same. That basically the standard, what we will have by doing this is we'll have, the same standard. And indeed, you are right. At the next step, the first step is to have this agreement between the EAPCI and each individual countries. And the step after that will be to have the fact that indeed somebody's trained in Spain could work in Switzerland. That's indeed the plan. But of course, it will be only possible with the next step. The first step that we want to, the first service that we want to provide is to be able to provide for this country something they are missing, that they don't have a theoretical exam yet. So basically their own certification currently is not complete. So they certify people, but basically they certify only based on logbook. They don't certify on theoretical knowledge. They have recognized that this is a difficult, because they did not do it because it was too difficult to organize. They want to have it, but they didn't organize. They didn't do it. So the idea, and they came to us to say, okay, we would be interested to use your EAPCI exam for us. So this is the first level of service that we can propose a good, well-organized theoretical exam to help every individual country to set their own certification. On top of this, they will receive, let's say, as an add-on, the EAPCI I exam. Of course, if we have enough countries in this framework, we will be able to have the option to have people, moving from one country to the other country, which is the next goal.
Dr. Kefo, what is the certification process in Italy?
Going. So the problem is the same problem in Italy. We don't have a certification examination. So this is left to the center and people. Theoretically, you just have to have a specialty in cardiology, and you can be an interventional cardiologist, which is not the case. I think these reflect the growth in the field, because in the last 30, 45 years, actually, because the first PCI was done 45 years ago by Grunzinger. I mean, the growth in the community, and indeed, despite the growth, we didn't give regulation. So what we have now, we have according to director of hospital, maybe, because you can do a public concurse to be an interventional cardiologist, and by the way, you never been in a car lab in your life. So the first problem, I think, is patient safety. I think we didn't talk about that. What about the patient safety? To be treated by cardiologists that did not have a certified or a proper training in interventional cardiologist. So we have to provide to our patient an interventional cardiologist who is properly trained, and this cannot be left to the discretion of each hospital. Honestly, I mean, I think this is a huge problem that we have throughout Europe. And in order to do that, clearly, having a model centralized by European Society of Cardiology, adapted to local community, because clearly we cannot think that the same standards are in the different countries, because we have different technologies, different access to technologies, different economical backgrounds. But it's aiming to have something which is supranational, actually, and applicable to each individual countries. I mean, that's the point. Also because if we want to be competitive with other subspecialty, we need to provide a standard of care to our patient. So we are working on that since some years, but I think we are in a very good point. And by the way, Bulgaria can be in the line as Spain and Switzerland, and work with the EAPCI to try to do something that can be applied locally. And then there was all the other discussion by the way of fellowship that I think is very important. That's another way to improve also the level of education of each individual interventional cardiology. This is a unique opportunity. I mean, I know that the majority are Italians, which is okay, I'm Italian, but I'm always surprised. So you have the possibility, this is for the younger of you, to come to another country for 1 year, that by the way is a very good experience of life on top of experience of professional, with some economical backup from European Society of Cardiology. We can discuss, maybe it's not enough for some countries, but for others it's okay. And you have the incredible opportunity to be with us in the car lab and be exposed to some technology and procedure that you can bring home. Or if you want to go to work outside, if we are working with this EAPCI certification and possibility of mutual recognition, you can bring in other countries. And again, that's a call also for Bulgarian colleagues, younger colleagues, apply for those grants, because it is also for you. And it's always quite surprising that we have only Italian, Spanish people, sometimes Germans, but not all the ESC community applying.
Yes, actually, now is the time for the application, so this is an appeal to our young colleagues. And I just feel now that probably in Bulgaria we have one of the most restrictive systems for certification, and practically one of the best structured approach to certification, which unfortunately is a good example that does not translate to the best quality. This is my internal impression. Maybe I'm not right, but Vasco, what do you think?
Yeah, the question of quality is always here, but my practical question would be, because now the incentive for the young interventional cardiologist to undergo certification, the only incentive is that without this certification, he cannot be contractor with the insurance fund. So how do we make our young colleagues to invest time and money in a certification process which gives them nothing? So that's the problem.
No, maybe my reply would be, again, this, what we try to, again, the main interest for you is whether or not you are interested to collaborate for the organization of the theoretical exam. Because again, the future of what we are doing at the level of EAPCI, our plan is to provide a platform that is there to be used in collaboration with individual countries. Of course, so this basically, this has only an interest if, I don't know, again, I don't know enough the situation in Bulgaria, but in other countries, we have understood that either they didn't organize any theoretical exam yet because it was too complicated to do and to sustain over time, or they have initiated that and they have stopped it because it was too complicated to organize over time. Because again, and we have realized, because we have created this exam for some time, then it's not so easy to organize a theoretical exam of good quality and to guarantee the quality and the standard of this theoretical exam, which is so. Our proposal is to say, okay, we should collaborate on this. By doing this, we will make sure that it will help to have the same standard or same kind level of standard across the different countries. The proposal is also, if a country is participating to this, then some local representative will be part of the people building the exam. Again, in the same model, I don't know if you know this model for general cardiology exam, but it is this model that it is currently used for the general cardiology exam. And each country has a seat and is participating to the building of the exam. And then this exam is part of the local exam. This is the case for UK, this is the case for Switzerland, this is the case for Spain yet. And basically, the proposal that we are making here is to do exactly the same for interventional cardiology. And by doing this, progressively, we will, we will have a kind of harmonization of what's going on in the different countries, with differences, of course, but with a kind of harmonization. So that's part of it. And at the end, again, the plan is indeed then the cost of this exam will be much less. It will be 200 euros, and this will be covered by the national society, not by the attendee. So basically, for the Spanish attendees, for the Swiss attendees, basically they will refer to their national working group, and the national working group will deal with the EAPCI. But basically, the local working group keep control of everything. So it's not against the local working group, it's in collaboration and to help them to provide their own certification. And at the end, the trainee receives the two certifications. And the cost for the trainee should be 0.
So, to summarize, probably there is a lot to think for the future development at the moment, and maybe it will be good if after this Congress, this is my proposal to everyone, because most of the influential persons are here at the moment. And maybe it's good to sit and to think about this national certification process to be performed. In Bulgaria, there is Bulgarian Society of Cardiology, there is Bulgarian Interventional Society, so we are two different societies, and this is probably another issue which we can have to decide who will be responsible for this, at least in interventional cardiology. In my point of view, that should be our society, but it's a question of discussion. And what else? So
maybe just what I could from our side, from EAPCI. So first, thank you for allowing us to present what we are doing, so you know what we are doing at the level of EAPCI. We will continue on our side to develop our own program and approach different countries. And of course, we will be very much interested. So if you believe that what we are doing is in your own interest, please come to us and we will be happy to adapt our own program to match what you are expecting.
Exactly. So thank you so much for everybody. And now is time to restore the glycemic levels. Lunch.